Welcome to Integrity Linguistics Institute. The fifth question: what point is being made in this guideline about patients with multi-trauma? Option A: staff should make it a priority to rule out spinal injuries. B: spinal injuries are missed in a small but growing number of cases. C option: there is evidence that immobilizing a patient with spinal injuries is helpful. So the fifth question, as well as the answer options, have been translated over here. Now, what we're going to do is do the keyword analysis of the question. What point is being made in this guideline about patients with multi-trauma? Option A: staff should make it a priority to rule out spinal injuries. So combining the answer option to the question, what do we understand? The guideline emphasizes that for patients with multi-trauma, staff should prioritize checking for spinal injuries. Spinal injuries are missed in a small but growing number of cases. Okay, so that is what B option is telling us. So combining answer option B to the question, we understand. The guideline highlights that in some cases of multi-trauma patients, spinal injuries are being overlooked, and this is a growing concern. C option: there is evidence that immobilizing a patient with spinal injuries is helpful. So what does that tell us? The guideline emphasizes that there is evidence supporting the benefit of immobilizing patients with spinal injuries among those with multi-trauma. Now let's read the text that is given in your question paper. All right. Amongst adult patients suffering high energy multi-trauma, approximately 5% will suffer a significant, that is, mechanically unstable vertebral column injury, VCI, and significantly less than 1% suffer a spinal cord injury, SCI. The main risk from undiagnosed unstable VCI is that further neurological compromise will occur. Balanced against this rare but potentially catastrophic risk is the fact that the majority of trauma patients do not have a VCI, and prolonged application of spinal precautions and immobilization is associated with multiple complications, including pressure sores, raised intracranial pressure, or ventilator associated pneumonia. Furthermore, the efficacy of these interventions in reducing secondary neurological compromise is controversial. Therefore, patients in ICU should undergo spinal evaluation by CT imaging and interpretation by a consultant radiologist within 24 hours of injury. If imaging is undertaken out of hours, it is acceptable to continue spinal precautions overnight and review imaging early the next day. All right, so let's understand that very complex paragraph in simpler English. Checking for possible spine injuries. In adults who have had serious accidents, about 5% may have a risky problem with their spine, and less than 1% may have damage to their spinal cord. Not finding these spine issues can lead to more nerve problems. But most trauma patients do not have spine problems, and keeping them stiff for too long can cause other issues like sores, increased brain pressure, or lung infections. Plus, the effectiveness of these measures in preventing further nerve issues is debated. So, people in intensive care should get a spine check with a CT scan by a specialized doctor within a day of the accident. If the scan is done at night, it is important to keep the person still until they can be checked the very next day. Okay, so this is the paragraph in simpler English. So it was not an easily understandable paragraph, but we have done our best to make it as easy and understandable to you. So please make sure that you're pausing the video and going them point by point along with the translations if it is needed. Now, the fifth question, and what is the answer to it? What point is being made in this guideline about patients with multi-trauma? The correct answer option is A. Staff should make it a priority to rule out spinal injuries. So let's understand why answer option A is the correct answer. The answer, staff should make it a priority to rule out spinal injuries, is justified by the content of the paragraph. The paragraph discusses the evaluation of potential spinal injuries in adult patients with high energy multi-trauma. It highlights that while a small percentage of these patients may have significant vertebral column injuries or spinal cord injuries, the majority do not. The main point being made in the guideline is that medical staff should prioritize the assessment and rule out of spinal injuries in these patients. It emphasizes that the risk of undiagnosed unstable VCI is significant and could lead to further neurological compromise, which is why early evaluation through CT imaging by a consultant radiologist within 24 hours is recommended. This underscores the importance of promptly ruling out or diagnosing spinal injuries in multi-trauma patients, as failure to do so can have serious consequences. Okay, so for that particular reason, answer option A is the correct answer option. Okay, so now we know the reasons why we should choose answer option A. Now let's understand the reasons why answer option B is wrong. B option, spinal injuries are missed in a small but growing number of cases. This answer is incorrect because the text does not indicate that spinal injuries are missed in a small but growing number of cases. It discusses the risk associated with undiagnosed, unstable vertebral column injuries and the potential for further neurological compromise in patients with high energy multi-trauma. However, it does not suggest a trend of an increasing number of missed cases. The focus is more on the balance of risks and benefits associated with spinal precautions and immobilization. Okay, so that is the reason why answer option A is the incorrect answer option. Now let's understand why C option is wrong. There is evidence that immobilizing a patient with spinal injuries is helpful. This answer is incorrect because the text actually points out the potential complications associated with prolonged application of spinal precautions and immobilization, including pressure sores, raised intracranial pressure, and ventilator-associated pneumonia. It also mentions the controversial efficacy of these interventions in reducing secondary neurological compromise. The text does not support the idea that immobilizing patients with spinal injuries is conclusively helpful. Okay, so that is the reason why answer option C is also eliminated.